47 million Americans across the country do not have health care.
We cannot get to universal health care, which I believe is both a core democratic value and an imperative for our country, if we don't do one of three things. Either you can have a single-payer system, or, which I know a lot of people favor, but for many reasons is difficult to achieve, or you can mandate employers. Well, that's also very controversial. Or you can do what I am proposing, which is to have shared responsibility.
Thank you, Mr. Obama.
Thank you for giving me a chance to be healthy.
Thank you, Mr. Obama.
Thank you for supporting my right to be well.
Thank you for giving me a chance to be healthy.
Thank you for supporting my right to be well.
Thank you.
Thank you for fighting
To give me a second chance.
Thank you, Mr. Obama. Without your health care reform, I wouldn't be here.
I wouldn't be here.
I wouldn't be here.
I wouldn't be here.
Our single-payer systems are Medicare and Medicaid,
Sure.
and Medicare is quite popular. The good thing about single-payer is the administrative costs are quite low. We probably waste $200 billion a year between the insurance administrative costs, the doctors and other healthcare providers' administrative costs, and employers' administrative costs in healthcare that we would not waste if we had any other country's system. On the other hand,
The United States has one of the most expensive healthcare systems in the world.
Prices of procedures are considerably larger in the United States rather than other countries.
By switching to a universal healthcare system, a large sum of money would be saved annually.
But it would certainly save them money in paying for their health care. Overall health of the United States would increase as far as affecting the individual.
Universal health care could potentially cut spending on health care in half. For as much as we spend on healthcare nationally, there is no way the U.S. should be ranked last among other countries. The U.S. spends the most out of all countries, but ironically we have the worst healthcare. When people don't have healthcare, they go without necessary medical treatment. We are one of the least efficient developed countries in the whole world. Lower class people in foreign countries are more likely to get recommended medical help than lower class people in the United States. The U.S. comes in last amongst other countries in regards to healthcare. The U.S. has a high infant mortality rate and a low life expectancy.
We set out to see what people's thoughts were on universal health care.
Is it the healthcare that's like given to people for free? Is that the thing? Is that what it is?
Just, I don't know.
You don't know?
Just like healthcare, I don't know.
Alright. What is that? I don't think of anything. I don't know.
Right, I don't know what that is.
No idea?
When everybody gets healthcare.
You can't blindside me with this guy.
I just did.
I don't know.
You know what? I just think of Obama and how he has ruined our country with healthcare. Obamacare is a joke. It needs to be out of the country right now.
Freedom, Obama, and Canada.
Barack Obama.
Obama?
We discovered that from several interviews, our classmates are very undereducated on the topic of universal health care.
In addition to universal care, our healthcare system has to be better organized, what's referred to as a medical home, where each individual is assigned, goes to a group or a team that oversees the care.
So if they don't have health care, then they don't really get coverage, then they avoid going and seeking medical attention.
Correct. So if they had coverage, in theory, you would prevent a lot of illness and utilize prevention and health care, health education. So certainly they could be made a lot better.
Is there anything else you think is wrong with the current system, like Obamacare?
Well, it has so many rules and regulations that nobody ever even had time to read. As they say, it had 2,400 pages, and not even the people that voted for the law had read it, or their staffs hadn't done it. So there are many rules and regulations that add to the cost, and so I think that's one big expense that's unnecessary.
How does the United States health right now compare to health in other countries, such as in Europe and in Asia?
It depends on what you're evaluating. If you're talking about the number of infants that live the first year and all, we're way down the list.
Oh, really?
Yeah, as far as results. If you are talking about
why do you think that is?
Because of the unequal distribution of care. Some people have insurance, some don't. But if you compare us with, I think Sweden is universal care, for example, then their survival of infants is far better than ours. If you
617.
Turn it up to me.
777.
Hi, can I speak to a Benjamin Day?
617.
You have to call him on his cell phone.
3422.
He's in Boston, I'm in Philly.
Alright, thank you.
Hold on just 1 minute, let me give it to you.
Alright, thank you.
It's 617.
617.
777.
777.
3422.
3422. Can I read this back to you?
Sure.
617 777 3422.
Correct.
Alright, thank you.
Hey, you reached Ben. Leave me a message and I'll get right back to you.
Hi Ben, this is Ryan Jones, and I am making a documentary about the benefits of universal health care in the United States. And after a couple interviews with nurses and doctors, I have found that universal health care is not favorable in the United States to some, and I would like to know your thoughts about this and why you think it is beneficial. Thank you. Bye.
How can I?
Just say password Zareta. Yeah, can I speak to Zareta Osa?
Speaking?
You're speaking?
Yes.
Okay, yeah, we're making a documentary about the benefits of universal health care. And after talking to a bunch of nurses and doctors, we found out that it's not really favorable in the United States, and we'd just like to hear your thoughts on that.
So, what do you need to do?
We're making a documentary in our English class about the benefits of universal health care, and we interviewed with doctors and nurses and we figured out that it's not really favorable. It's not like popular in the United States, and we would just like to hear your thoughts on that and like what are the benefits of universal health care.
Universal health care is, it would cover everybody. It's pretty much what we are asking is pretty much like Medicare that we have right now in the United States for older and handicapped people. That they just go to the doctor and they get, they're assigned or they can choose a health insurance. And they go to the doctor and they pay the deductible, whatever, which is small many times, and they just get covered and get, if they need an emergency, if they need preventive health care, it's pretty much, that's what we are looking for.
What about people who abuse healthcare privileges and refuse to pay?
People that refuse to pay, well, it would be like with healthcare, with universal healthcare. I mean, that's something that you cannot. It's very difficult to stop, but boundaries can be set.
Because after talking to doctors, we found out that's like one of their main issues is people abusing the Obamacare system and getting by without paying anything or not doing anything just to get free health care.
Abusing Obamacare?
Yeah.
That's what you're saying? But Obamacare is not universal.
Is it not universal? That's what, yeah.
Obamacare is not universal at all. Obamacare is just an extension of the same services that people have all around, with the difference that if you don't work, you have to pay for your own or apply to get subsidized. But when you apply to get subsidized, you get the minimum coverage.
Mm-hmm.
The minimum coverage, and it's very high, out-of-pocket expenses.
Yeah,
so that's not universal at all.
Okay. And another main...
if people are abusing that, I don't know how.
Yeah, that's just what the doctors were telling us. Another complaint from them was that the waiting time for like procedures would increase. So like, what would be a way past this, do you think?
Well, that's it. I mean, if you look at the Canada model, that's what we're looking at also.
Mm-hmm.
The waiting is not as bad.
It's not?
It's not as bad, no. Before it was really bad, but they have fixed that. And we are looking at that model to use it as something to start here.
And what have they done?
Sorry?
What have they done to improve like the waiting times in Canada?
They have asked the doctors to spend a certain amount of time with the patients. That is not as little as the private insurances here allow you to. Because here it's like, I think it's 10 minutes.
Okay.
And over there it's a little bit more. But before that, they didn't have like a restricted time, and now they're restricting a little bit more the time.
Okay.
So that's mostly, yeah.
I do believe that everyone in the United States should have health care, but I also believe everyone in the United States should have a job.
I think everyone having health care is good because everyone's covered. No one can charge a lot of money.
I do. I think it's the government's job to provide it, but I also think people need to pay their part.
All of them.
Yeah.
I feel that everybody in the United States should have the opportunity to have health care.
Yes.
Health care.
Absolutely.
So, like, what's wrong with our current healthcare system that we have?
I would say the incentives to the provider is probably one example of how it's set up wrong. Right now we're kind of incentivized to see people based off volume more than anything. So we get paid every time you come in, and it's not necessarily possibly a value. So we're not treating the whole patient all the time, such as a diabetic. We wait till they have an issue possibly with their diabetes, and they come in to see us. They call us, come in to see us, and then we treat them for that issue then, when we should be treating the whole diabetic all the time for their diabetes, not necessarily for the issue. But right now we're incentivizing more to bring people in based on volume, not necessarily based on value.
So how do you think the universal health care would affect the overall health of the United States? Positive or negative effects?
Well, I would say that's probably hard to say. Yeah, I mean, I think, would more people use it if it was less cost to them? Possibly. But you look at that and go, we have Medicaid that covers those that are indigent that possibly can't afford it. Those that have insurance may have a high deductible, so maybe they're not coming in to see the provider when they should because it may cost them out of pocket. Then you look at it and go, the wait times in a universal healthcare system is astronomical. So you could be really ill and you can't get in for weeks or months. And if you have insurance and you can pay that deductible, or if you're an indigent patient and you can go in for free, you can be seen fairly quickly and get that taken care of. So could it cost the patient less financially? Yes.
How would you think a universal healthcare system would make it easier or harder on your job?
Well, my job, universal healthcare, would probably, for the most part, my job, I hate to say go away, but it would definitely minimize the obstacles and minimize the amount of work that I do because you have one payer system. Yeah. And so there wouldn't be a negotiation with Anthem or the Humanas or the Uniteds or even the Medicaids. So we would go down to one system and one rate.
Everybody from one corner of the U.S. to the other needs to have universal health care.
Through this journey we have taken exploring universal healthcare, we have realized a couple of things. We have realized that the healthcare system in place is obviously not working, with over 47 million uninsured throughout the United States. We have also realized that the steps towards universal healthcare could be very hard if everybody does not jump on board.
This, yeah, it doesn't. It's stairs, but you just put this back. Yeah, if you come stairs.
What we challenge you to do as young Americans is to educate yourself on universal health care, so when the time comes for you to vote, you will make a smart and correct decision.